Debunking COVID-19 myths. Myth 1.
I'm not scared of COVID-19. Africans cannot contract the virus.
COVID-19 can affect anyone of any race, nationality or skin color, as we have seen in many African countries, including the Gambia.
Myth 2.
Is it true eating garlic can help you prevent getting COVID-19?
No, there is no evidence for that. Keep washing your hands. Maintain at least 1 meter physical distance from others and use the preventive measures to protect yourself and the people you love.
Myth 3.
Hi, did you know that Gambia is spared? COVID-19 cannot survive in hot climates.
Actually, COVID-19 survives in all climates, hot or cold. Look at our neighboring country. We have to continue washing our hands and avoid touching our eyes, nose, and mouth.
Myth 4.
COVID-19 that only affects the urban areas. We are not affected here in the rural areas.
No, not all cases are in the combos. There are confirmed COVID-19 cases in other regions of the Gambia.
Good evening from the Gambia Radio and Television Services. We welcome you to yet another edition of our COVID-19 sensitization program. The program is brought to you courtesy of the Ministry of Health in collaboration with the International Organization for Migration, IOM, and partner agencies. And it is aired through GRTS, QTV, Paradise TV, Star TV, iAfrica TV, and Muslim Television Ahmadiyya MTA. My name is Mama Jay, and I have with me in the studio tonight Mr. Sheikh Omar Silla. He is from the Gambia College School of Public Health and member of the COVID-19 Risk Communication and Community Engagement Team. Mr. Silla, welcome to the program.
Thank you very much.
And on my left, I have Dr. Adam Masala, Senior Consultant and Pediatrician and General Practitioner. He's wearing a lot of caps. Of course, his title is going to be long. And he's also the Chairman of the Board of Directors of Edward Francis Small Teaching Hospital and President of the Pediatricians in the Gambia. Dr. Sala, welcome to the program.
Thank you. Thank you, Ma'am.
And our sign language expert here today is Mr. Bakari Sane, who is going to translate the same message in sign language to our viewers out there. Well, tonight our topic will be continuity of service. And to lead us into that discussion, we're going to turn to Mr. Sheikh Omar Silla. Mr. Silla, when we say continuity of service, what does it have to do with the fight against COVID-19?
So thank you very much, Auntie Mama. We know that COVID-19 has put a lot of pressure on our healthcare systems. I mean, healthcare systems around the world. It has, in fact, defaulted a lot of response power when it comes to us, fighting a lot of other underlying issues in the country. So COVID-19 alone is a problem and has made the health system, defaulted a little bit all around the world and has made us off guard. And as far as the fight against diseases are concerned throughout the world. So what that means when we say continuity of service is we're trying to run away from service disruption. We do not want to disengage our services, the routine services that we have before COVID-19, being the maternal and child health services, being the mental health services, being the reproductive and health services, family planning service, and all the services that are routine in our healthcare system. So we do not want COVID-19 to come and stop those services. And in fact, we know COVID-19, is one of the issues with COVID-19 is that it puts too much pressure to underlying health conditions. And those underlying health conditions are already in routine health services, being the diabetic patients, being the malaria cases, being diarrheal cases, and other cases within care settings. So COVID-19 coming is good because it will give us the chance to have dual track health systems, throughout Africa, throughout the world. Because before COVID-19, our health systems have single channel health systems. But now you're seeing that we're having dual track health systems. We're caring for COVID-19 patients and also increasing our capacity to also care for other cases, just like malaria and other routine service cases.
Okay. We now turn to Dr. Adam Masala. Doctor, continuity of service, like Mr. Silla said, it's important as well in the fight against COVID-19. Could you further simplify this for our viewers?
Well, thank you very much. I think first and foremost, one needs to realize that the diseases that were here before COVID are still with us. They will remain with us during the COVID period. And even after COVID is done, or after it's gone or is adequately suppressed, we'll still be having these diseases around. So it is extremely important that the services we have been rendering in terms of prevention, cure, sensitization, and promotion still continues. In the pediatric age group, Gambia is known to have a very good vaccination program, which has brought down many serious, the prevalence of many serious pediatric diseases, and that program should continue. It should not be interrupted. If you look at the statistics, virtually most of the childhood killer diseases are going down, with the exception of neonatal diseases, diseases of the newborn. Unfortunately, they are on the increase. And we should have a targeted sort of intervention in that area. But as Mr. Silla already mentioned, other infections are still here. We have respiratory tract infections. We have diarrheal diseases. We have malaria. We still have HIV/AIDS. We have TB. We have skin sepsis, skin infections, especially this time of the year during the rainy season. And people with their diabetes, they still need to be monitored and cared for. People with high blood pressure and other cardiovascular conditions, they need to be monitored. Diseases in other organs and organ systems like urinary tract infection still need to be monitored and cared for. Pregnant women, need to be adequately cared for, and the complications of childbearing and delivery, all that has to be cared for, and so on and on. The list is long. So we should not have a cessation of service because COVID is here. Of course, COVID is new, it's very aggressive. It has a very high morbidity and an increasing mortality rate. So we have to give it the attention it deserves. We need to really do everything we can to limit the negative effects of the pandemic. But at the same time, we should also give other disease areas the attention they deserve.
Now, we know that COVID-19, which is an airborne disease, it's still showing, no sign of leaving us now. And the conditions that you mentioned, for example, diabetes, high blood, asthmatic patients, patients with that conditions, those conditions actually are not visiting the hospitals as we, understand because of the COVID-19. Is it also not going to add another problem to the one that we already have?
Yes, indeed. What I always tell people is, in the process of solving a problem, you don't want to create another one. As I said, these diseases are still around, and they will deserve the attention that is necessary. COVID is with us. COVID is a relatively new disease. We do not know how long it's going to be with us. We do not know how the intensity is going to vary. In fact, we do not even know if it will ever leave us. even if we get vaccines and medicines, it might be suppressed to a level where it's controllable. But there is no guarantee that it will disappear anytime soon, just like other viruses. There are viruses that have been with us for centuries and they're still around. They're controlled by virtue of vaccination programs and symptomatic treatment. So COVID might run the same course. Now, it would be very unfortunate if people, because of COVID, they don't go to the hospital, clinic, or health center for the care they need. Your diabetes is still with you, your high blood pressure is still with you, and so many other diseases. And actually, if you have those diseases and they are not well managed and controlled, you are more prone to the negative effects of COVID. As you have heard probably, COVID tends to kill people with comorbidities. That is, people with other underlying serious conditions. And even if it doesn't kill them, they tend to, their COVID seems to run a more severe course. So it is extremely important that those diseases are monitored and the necessary interventions carried out in terms of control and monitoring. So I would strongly urge anybody who's suffering from any underlying chronic disease to continue to go to their doctor or nurse or wherever to be monitored and be managed as before. And with COVID, maybe there's even reason to intensify that management, to even give them better care because of their vulnerability.
Okay. And Mrs. Silla, what measures are there, since we all know, like Dr. said, COVID is not showing any sign of leaving us now or soon. What measures are there to ensure that people with some of these chronic diseases like diabetes, high blood pressure, and asthmatic and other ailments to visit hospitals and then to know that, the disease still exists, and then the new one that comes in is not going or is not leaving us now?
So definitely there is aggressive community engagement. There is aggressive risk communication going on radio programs, on TV stations, just to inform and re-inform the masses on the need for healthcare seeking behaviors. We know Gambians obviously are very good when it comes to healthcare seeking behavior. We have high sense of positivity for our healthcare seeking behavior. So COVID-19 is here, yes, but it should not disengage that positivity towards healthcare seeking behavior. And now we are in a very stressful situation because COVID-19 is here, but the symptoms of COVID-19 is overlapping with other symptoms in the system. Malaria, for example. We're seeing a lot of clinical presentations of malaria cases in our facilities at this moment. And that is giving us a lot of stress in the healthcare system. And that's why we're going out to make sure we communicate to people. And right now we're seeing a lot of people with flu symptoms. This is overlapping with COVID. Now also you will see, when it comes to our statistics, now about 60% of the cases that we are having that are turning positive for COVID-19 are suffering anosmia. I mean, that is, sensing the loss of taste, and, agresia, which is sensing loss of smell and all that. So that problem still exists within the care setting. So there are symptomatic overlaps with COVID-19, malaria, and other cases. So that's why it's important. We must re-emphasize that it's important. That is why the healthcare facilities are readjusting in our screening behaviors. We are readjusting in our triaging systems. We are readjusting in our referral systems. We are readjusting to even targeted referral systems now, so that we will be able to move forward and contain COVID-19 in this country. So people must come out. Do not stay at home with the clinical presentations of some of these issues like malaria and cold, just to say that when you go to the hospital, maybe you will get infected. That's not the case. The hospital, the treatment centers or the care facilities are very much safe for you to visit.
Now, since community service is a broader topic, and of course we also want to look at nursing mothers and pregnant women who usually or normally visit health facilities for their routine antenatal service. Because most of these women are now reluctant to go to the hospitals, you know, to take their routine services, health facilities at the health facilities. Now, what are we doing to get back those nursing mothers and pregnant women, you know, because it is important for them and their babies?
So definitely, and I will advance that to reference on statistics that is currently showing, especially within the Western World Health region. We're seeing a drastic reduction in the number of, I mean, when it comes to the significance of people actually coming out for the routine services. That is the EPI services, the expanded program immunization. That is the routine clinical service that we are having, the vaccine shots. So we are seeing a significant reduction within Western World Health region. And this has been reported by the ROO, which is the Regional Operations Officer for the EPS program services in Western World. So what that means is the women and children in Western World are losing a lot of essential vaccines in the routine immunization services. And that does not translate very well because COVID is here. And who knows, perhaps those immunization services is actually helping us boost the immune system of these children who are completely vulnerable to COVID-19. So the statistics coming out from Western World Health region is, the indicative statistics coming out from Western World Health region is not very much encouraging. So we need to reboost that to make sure women and, you know, are actually coming outside. Coming out to continue their services for this care. And just to emphasize, now it's needed. Women are vulnerable to COVID-19, but most of them would complain they are afraid to go to the facilities to get vaccines. Now, the EPI service, the Ministry of Health is looking at observing all the precautionary measures that applies that could actually save you in contacting COVID-19 at routine services. So you don't need to be afraid to go there. When you get to the service end, physical distancing is observed. I mean, you wash your hands before getting into the healthcare facility. And we are making sure that we expedite the process of waiting times, in fact, when you go to the clinic. Instead of spending a lot of time, we just make sure that the screening services is done at an expedite process. And the individual or the woman wouldn't stay long in the queue or within even the waiting room so that we could break down the chance of exposure in the care setting. So it's important for people to come out, Mama, I'm saying, and Western World Health region, the statistics coming out now, the indications coming out now from the statistics is not very much good.
Okay. Doctor, COVID-19 and breastfeeding, can a nursing mother or a lactating mother, you know, who is infected with COVID-19 transmit the virus through the baby, through breastfeeding?
Well, as far as I know, there is no clinical evidence suggesting that. When it comes to virus like HIV, for example, that has already been proven. But COVID is relatively new, and we are learning new things about the disease all the time. But what I've seen so far in the scientific literature, there is no concrete evidence that we can catch COVID through breastfeeding. But if the mother has COVID, because of the close proximity to the baby, it can be spread through respiratory droplets. And it's been shown that small children and babies are actually among the drivers of the epidemic, because it's true children have a tendency to be less ill than adults, but they tend to harbor large quantities of the virus in their airways. And in that regard, they're efficient transmitters of the virus to other people, other children and adults. And this is one of the arguments that was forwarded why maybe they should not be going to school and daycare centers and so on. But to add to what he was saying, of course we have to adapt our healthcare facilities to suit the COVID context. First and foremost, we should avoid congestion to the extent possible. Social distancing should be maintained. And people should be encouraged to be wearing their masks. There should be adequate hand washing facilities. And then the time for consultation and whatever service is going to be delivered should be shortened as much as is humanly possible. And now, even within the essential services, there are some services that are less essential than others. For example, vaccination is very, very essential and should be carried out. But anthropometric measurements, like measuring height, weight, and all these things, they can be deferred. They can be deferred. And then also, the waiting areas can be adjusted in such a way that some people can wait outside in something like a tent, a makeshift tent or whatever. So you don't have too many of them indoors.
Overcrowding.
Overcrowding, because the transmission is more efficient indoors than outdoors. So you can have people sitting outside in tents and they will be brought in one after the other as the system allows.
Okay.
So there are all these precautionary measures that can be taken, but people must also be sensitized so they understand that it's available. So they don't have to be afraid, that they are safe as sitting at home, you know, or going out. So if they know that, at least there's enough reassurance so that they're not scared. Because it often is fear for the unknown. You don't know, and you think if you go there, you will catch COVID and with all its consequences. So there cannot be enough sensitization. We should go ahead and inform the public repeatedly so they understand that the health system is also very concerned about their safety.
Okay.
But at the same time, we want to maintain effective management of their conditions.
Okay. Okay. Viewers, you reminded that you're watching your COVID-19 sensitization program here on GRTS in partnership with its sister television stations in the country, QTV, Paradise TV, Star TV, iAfrica TV, and Muslim Television Ahmadiyya, MTA. And the program is sponsored or funded by the Ministry of Health in collaboration with the International Organization for Migration and its partner agencies. And we now let Mr. Silla to give us his last word so that we can allow in Mr. Usman Dabo also to come in and join us for the discussion. Mr. Silla, what would be your last word?
So my last word is COVID-19 is real. It's in this country. Our care-seeking behavior must be adjusted. Let COVID-19 don't deprive us from getting what is necessary at healthcare facilities. A lot of our older generation, our older people, other population have underlying conditions. So we must do our best to make sure that when they need essential services, they are taken to the hospital. And we sure we will win COVID-19 very soon in this country. Inshallah.
Very well, Mr. Silla, thank you very much once again for joining us. And time now to take our first break. We'll be back after this break.
Debunking COVID-19 myths. Myth 1.
I'm not scared of COVID-19. Africans cannot contract the virus.
COVID-19 can affect anyone of any race, nationality, or skin color, as we have seen in many African countries, including the Gambia.
Myth 2.
Is it true eating garlic can help you prevent getting COVID-19?
No, there is no evidence for that. Keep washing your hands. Maintain at least 1 meter physical distance from others and use the preventive measures to protect yourself and the people you love.
Myth 3.
Hey, did you know that Gambia is spared? COVID-19 cannot survive in hot climates.
Actually, COVID-19 survives in all climates, hot or cold. Look at our neighboring country. We have to continue washing our hands and avoid touching our eyes, nose, and mouth.
Myth 4.
COVID-19, that only affects the urban areas. We are not affected here in the rural areas.
No, not all cases are in the combos. There are confirmed COVID-19 cases in other regions of the Gambia.
Welcome back, and you reminded that you're watching your COVID-19 sensitization program on GRTS, Paradise TV, QTV, Star Africa, iAfrica TV, Star TV, and Muslim Television Ahmadiyya. And we're discussing continuity of service. And tonight, of course, we had Mr. Silla and Mr. Dr. Adamasala, and we're just joined by Usman Dabo. Badun Milikan Jibengal Kontong, GRTS, Murutale Nanye Kotenke, al COVID-19 sensitization program Minka Natalie, and ni GRTS na de nyol, Mimu, Paradise TV, QTV, iAfrica TV, Star TV, Muslim Ahmadiyya TV, million ko depends on the Ministry of Health, wala jata kende ala bundati, ani denyol, Milboko International Organization for Migration, ani mo kotengol milialon ko wala bo institution kotengol milialon ko ifane lié dabula ñim programme to pour kaje ko mol nge karandi nge fahamundi ñim courant la mi mo COVID-19 te min natanen sainten dron ka fuma dron wala Usman Daboti ate bota Ministry of Health le ate fana mu member of the COVID-19 committee leti risk committee li ani program officer maternal and child nutrition directorate of health promotion, Mr. Dabo, baraka bake. Okay, coming kachabi, woleng continuity of service. Ninko continuity of service. Munem wati ni COVID-19 kelo nyento.
Baraka bake. Niaje nying ku ngasamana woleng. Mol delta tar na loptanol to. Dita loptanol to kajata kende akul misoroji. Coronavirus la ko manyana nala wole tu koma ngan ko COVID-19 birana ta ko jamale jahase wala ngay mol ki jol farandle ko pour kata loptano ta aka ko leya mol bulu ko sam janning coronavirus binala safo ko man sakunda e sarto lan le mi yalon ko e ko jamale kele ku folo wala dindingol mi yalon ko be sanjulul kata duma ila sasal nin ko min indil katu dami wol ye do kubal leke wol to yaje ko sa wortalata bakel musukono mala fanan komi ye kono bela e netuje wolle be wulu kay netuje wolle tay wulu netuje wol be kulati mi yalan ko an atalata bakel nyim banko kanne anim fanan sa dol fanan bije komi yela selo sukuru kurangol jusu problem wol ning ko kili problem wol be wala kedde ning hard problem de wol be kulati mi yalan ko ben fejanne annum fanan ye mantorol ken kanne par mi kukilin natna wala italata wala wati ikata bari kata loptano te ka cekiro nyin akatu inila doctorol tema dol biye sa fay loko isna dol ya fay kare wala kare fulo karfla wal katu imari ni la doctorol tema bari wala nyin kolte ku laltin la famille senen la fosako membe ko dinni wala nostal dinni wala nosta ku mata bakel ko ni ajwe dinol ka pengo minta akay tankandi loptan jamal ake tankandir sasa jamal la folo tetanus bijel to nja kurangol bijel sisi kurangol bijel ka fami pneumonia an wolbe bijela nen kata to kurangol wolbe pengol bijel sa nen dingol sita soko ne man taw pengol la e bajela ko sasa polio fanam bijel la fan kurangol so anen fusi ba kurangol siatal de be fono la bar nen mol sita soko ne man taw pengol ta e bajela woni sasa fana wultana coronavirus fam mantoro min la ka wol bina wala lalanka so mukulete mi alanka ku mata bake muskono ma fana ni tara nos ila ta kuto e ka jibel fo ni sasa dol man dun nan kono ma yakono yela mankol bi jele yela selol bi jele ni wol bi je ka borole di la mi alanko asa ma koy no iten niyo kana to wolle e kana fo dingo fanana so wol benam be ku mata jele wala sa fo muskono malle e pour fana ni ya kalam to ko har jibela iseta nos ye checkir bi je pour ya kela o fana ku mata bake mil fana yalan ko komi nga fanya mi yele sele tol ni sukur kuran tolu yalan ko sasa bela ni te wati ka cekroke ni le tamo sita pour ya ka ta loptano te cekroke akumata bakal
Okay, woku maita bake mbadi milkan jibe aliyo moyle womu kibari kuma baleti mi yalonko misadabo ya to janto puruna mulla mbadi ngol mi yalonko kono mato leng dimba tiol puri sita nosi kata ke la dindol sambani fangol fang ke samba e saje eta yela service o mi yalonko e ka sotono jata kendi yala karola e sa asi continue bari kurando fana nato wo fana ka futala ni ite ku problem mol soto already problem do nata na kafutala wo kasiya bakele mbokay ñu sétane ñu leen di nuyu fi ci sen programme yi COVID-19 sensitization bi bi nga xamné GRTS ak natangom ñoo leen di isil programme bi di QTV Paradise TV Star TV ay Africa TV ak Muslim Ahmadiyya wala Muslim Television Ahmadiyya ñom ñoo leen di isil programme bi waye naka ñi nga xamné ñom ñoo tabal sen loxo ci programme bi dépense ko ba ngeen mën ko gis moy bunti kuréeli nguur gi saytu wérgu yaram bi muy Ministry of Health ak International Organization for Migration ak yeneen yi naataango yi nga xam ne ñoom ñoo tax ba programme bi ne mun a egsi fi ngeen di seetaane ñu am fii nii kii nga xam ne moom mooy docteur Adama Sallah docteur Sallah nag tey li ñuy waxtaane mooy continuity service maanaam gannaaw wala booka balaa COVID-19 bi feebaru mbas bii nii amoon na yeneen feebar yi nga xam ne moom lañ fi am naka la ñuy def ba nga xam ne feebar yooyu noonu ñii nga xam ne ñoom ñoo ko am ñuy dem seeti kër docteur su ko defee COVID-19 wala feebaru mbas bi bu mu gën a yokka li nga xam ne moom mooy looraange yi ñu am docteur Sallah.
waaw jërëjëf maama foog naa mbooloo mi waruñoo ñi ñoo seetaan waruñoo réeree mbir ne feebar yi fi nekkoon balaa COVID-19 bi ñu ngi fi benn tey te dañ fee nekkaa ñun ak COVID-19 su COVID-19 demee tamit dañ fee nekkaa ñun benn tey ñun sax óoruñu ndax COVID-19 dina dem ba jeex.
docteur war naa dem de.
non kenn xamagul mun naa am ñu wàccee ko ba nga xam ne du lorati nit ñi ni mu ñoo loree nii fi mu nekk waaye amuñ benn garantie because am na yeneen virus yoo xam ne ay téeméeri at ñu ngi ñun benn tey waaye deñuñ waaye nag contrôle nañ leen looloo tax ñuy ñàkk xale yi leen man bi maa ñëw fii 1982 feebari xale garaawoon na trop muy feebari ngas feebari pneumonia feebari malnutrition ak yooyu yëpp daal du doon jeex fii du xaaj waaye dafa mel ni vaccination ñàkka bi ñoo ñàkk xale yi dimbali nañu bu baax bi wàññeeku na li xala doy waar rek mooy feebari xale yi juddu ees moom moo nekk di yokku dafa mel ne liggéey bi ci faana boobu des na benn tey comme ñu gën a liggéey foofu
comme soo waxee feebar yu xale yu juddu ees
yu juddu ees mel ni feebari jafe-jafe pour nokki ak ay infection yi ñoo am ci seen lungs yeeg façon yooyu ak even ay meningitis yooyu li leen day rey benn tey mu ngi fi te dafa mel ni dafa xala yokku yenn yëpp a ngay wàcce waaye moom ngay yokku te loolu nag dafa nekk lu ñu war a gën a seet naka la ñoo saafara waaye ñi am ay diabetes high blood pressure ak jigéen ñi biir ñi ñoo ñëpp benn tey toppatoo bañ soxla dafa war a continuer te ñu ngay gis ne daal ñu bare ngay ragal a dem ci lopitaan yi pour ragal ne suñ demee foofu dañoo am covid dëgg la mu ngi fi de dañ ko war a jox alxam def luñ ci mun suñ kéemtalaay kàttan waaye warata tax ñu tegee boor yeneen feebar yi because suñ defee loolu yeneen feebar yooyu dina rey lu ëppali covid di rey loolu la nit ñi war a bàyyi waaw covid a ngay rey covid garaaw na trop waaye di nga gis ne junne lu toppa ci liñ amangu dafa mel ni ay li deyangu mutut ñaar fukka sax ci liñ xam waaye di nga gis ne feebar yi ñu ngay rey benn tey te dafa mel ni suñ leen toppatoowut bañ gën a garaaw dina gën a rey covid
ok docteur dina ñëwaat si yow fi mu nekk nii mbaɗigol nga nasañin Mr Daboto baɗi nga jelo ko kabiriñin COVID-19 courant o naata musol miliyalon ko wala bo mol miliyalon ko ikata non lopitano to miliyala ika diabetes soto asthma high blood anin courant ko tawol italata bakele na lopitano to andum wo fanan mu mantoro dolete ni yatara mol be sidi la sol kono problem mol be la ni yalon ko min denta nyin sa sala e manta lopitano to mo fon jama ba fala fam fo fam sunata wo contributor mol milka fa sol kono because they already have these conditions be pare bukata lopitano to
mama elo kumo nyata bake because comme mba foka nyamin covid to nyala natale bar sasa do fanam be fe kan janne mi yalon ko e ka mol ni ka to jele an mol ka fa so kono la no nywato asiata bake ko nka a report so ko mo fata so kono pare comme nin kiskisiro manke ay long ate seniano la fo o mo be ka fa coronavirus la no fana manjiki kol be ka fa coronavirus la comme ya fa nyamin mol bi jemi an ko sasa dol be la e bukata la chekiro la e bukata la ela sukurol jibe wala e bukata la appointment la kata ni docteur le nyoje wo fana se mantoro dol sino la meyat na ko sitan no so kono sasa e batandi fo e niyetuji so ngajale ko nyiwato mo jama ka fa so kono pare fo o kiskisiro sina ñaato ka tandi ko ñim mol min ka fa min ke fa kadu ngal ko mo fata so ko ne ka coronavirus test kela sa ni coronavirus test botaje dan ni wo ngaje ko coronavirus me fa dan kiskis lol finance na ajibe na tara coronavirus ya amari fanam fa because ngam mi fana lon je wala docteur mi fono coronavirus ni aja ka mol min batandi bak wala ka mantoro la mol min kam bak wala mol mi sa dol sor comme mi yela selol ni sukur kurangol ni sa dol so akumata bakela pour nga fu mo leta wa chekiro la kato nonte mantoro nying asembo bo warta bakel anum fanan se kuma kilin laji yalo bari nga pengu ko fo nin ko di la pengu fo nga je senende bakel because coronavirus la start wato mulka video le kilo ko ha pengol patanan china le kadinol pengol pour ka mul fa so fanan ko indi bakel ngatandi mol la ko coronavirus atla pengu amo soto folo anu dokul be ke kan scientist bela doko ke kan bar scientist amang pengu man soto folo anu pengu mam bonang china ka foko nin nata jambe ba tesla dini wala bala hani o man soto pour so ko indi molla
be pare fana ngam say do fana soto is very important and I think it is significant pour molia ka cha janto bare ni mari min fo because jama ika moy molela community to molka fo wokake consent mi alon ko molka ris because mo jama kala fi ke dabula program auto but ima opportunity so through some of these text messages in call ako jama camera dol camera ko fu safeo be kerine mi alon ko ni asidi ila bunda dala ete coronavirus to la fo na be kerine because ngama ila fana this herbalist ikafolo ko borol dol be kerine ni o me ite coronavirus to la aussi falbe fo world covid-19 aussi falbe ka jarale ma
sainten kiskisiro be dami wala coronavirus amam borso to folo boro mi yalan ko iba fele ba minna ay tay coronavirus ka kurango nyimfa anu ninga jefo fanan janne be ko jabla no te hakilo sa bola wala mul ka fa sanim bortala mul ka kende nyaadile nyantala no ko hada badum fam balo kono fengol lebi ka fu sa fu no balo la so jarol le nin sa dun de kono wala ka wuli ke loke ni wo jita wate lang sa jama ke batande so satani mo la ko han coronavirus na ay muta ila balo so jaro ka wulle ke loke ni coronavirus ni ano isafa ye kende ka ko le nyama so ka borol mindi mo la bordolo la ni ko ke deme ko ni boro dila ni ka to boro dila bare do ko be balo fon la kake ay kende so comme ka foko safo ka jaral le jin ka jaral se min fo mo le wala sainteng coronavirus borti je mi yalon ka lonta la borti je mi yalon ka approved la ka fo nyina ala boroti isa minule anon fana ni nata comme traditional treatment na fo ngang hakilo tije bake
te message kilimo ate mo kilimo ya fule ko tenke ko comme imamol dolem ate ala forotal message nyinto ya ikafo ha saljio doron woka sasa pasi ko sa mantara keri dunia kona ala man bodo ka miye ba saljio ni ka saljio muta wato wati coronavirus abuke muta so wol fanan ko letim yalon ko people have those beliefs
wolon kula mi yalon ko sa fo follow o ma wanko kuti mimbe sotarim because ngalon ko misimol le nyin kuran soto Gambia banko kanya because Gambia banko ni ajibe misimol siatal ando ita folo ko momo yalan ko nyin kuran ya bula amuta wolbe manke salji mutalati be manke sallati so ni ajibe saljio Sénégal ni ba saljio mutala anin Sénégal kata dino fama be ni Sénégal tata par o Sénégal fo yani sartul min balaren fo yani samba ka fo kasa joda manne mutaw bat na coronavirus tem mutala o mu kulete mi yalon ko nyanta o jibe kulala because misil mol le bije mi yalon ko ka salle wate an han kabi nyun kuran bela
akum mayata baake mbokay bete rek ñu fatali leen ne yéen a ngi seetaan seen programme COVID-19 sensitization forum bete rek docteur xam naa ne sax kii message am bi mu ngi dafa am ku ma seen message Mr. Concerned viewer boo xam ne moom tam mu doon wax moom dal na ma sax waaye dalu ma sax it na dafa concerne rek dama war a sol max man tamit waaye dañ gis na rek ñi nga xam ne ñoom ñooñu seexa ñu ngi sol max waaye ba tey rek su fekkee ne wérgu yaram laajte na ko rek ñun tamit ñu jox ñu standard max GRTS jox ñu standard max ñun tamit ñu sol ko waaye for now lii moo nekk standard bi nga xam ne moom lañ nekk di observe fii ni ak tamit physical distancing ak yeneen measures yi because ñun saa yuñ génnee si studio bi rek ñu ngi amee suñ max di ko sol suñ ñëwee di present si lañ dee nat buñ dee sol max because ñu ngi foog ne suñ caméraman yi ñu ngi am so yoo kenn yaa ngi toog yaa ngi wax xanaa léegi nga xam ne ñu ngi am ay guest te ñoo ñëpp tamit ñu ngi am ay max te distance bi tamit ñu ngi ko observe so loolu la waaye thank you very much for your concern ba pare benn viewer bi moom moo seen benn message bi mu ne dafa am ñoo xam ne dañ dee wax ne COVID-19 bi soo takkee téere daf la dee musal si feebari mbas bii nii ba pare tamit jàpp tamit saa yu nekk sooy jàpp parce que ñoom dañ believe ne ñu ne yàlla feebar bu mu isi si àdduna bi rek amal na ko faj soo jàppee tamit feebar bi mbas bi du la laal so loolu scientifically nan la demee ak li ñuy wax ne ak ñi nga xam ne tamit ñooy def traditional medicine yii nii nga xam ne dañuy defar ay reen ak yooyu noonu di wax ne daf dee mën a faj feebar mbas bii ne lan la si scientist yi wala health experts yi wax
ñu ne liñ xamangum ci wàlli science ak wàlli docteur feebar bi daal amangut faj bu óor am na nag ay xelaat ne lii dina faj la lee dina faj la ak lu mel ni chloroquine ak yooyu waaye bente amaguñ ci enough proof werante def ci am daal ba pare WHO World Health Organization ñi nga xam ne kuréel gi nga xam ne ñoo jiitu mbiri health ci àddina si mbiri wér gu yaram ñoom bente approuvé nguñ loolu waruñoo réeree mbir ne feebar bu ees la gowma kenn amagum na ci xam-xam wala expérience bu doy ci mbiri faj ndax faji tubaab la ndax faji nit ku ñuul nit ñi mun nañoo wax ne rek xëy na ñu ngi expériment ñu ngi jéem lii jéem la leen téere wala ay xunjowum ay yeneen ak yeneen waaye kenn amu ci benn proof dégg la yàlla feebar bu mu indi na saafaraam waaye saafara boobu ñu ngi ko ut benn tey kenn amangu ci lu la óor so buñ nekk di nax nit ñi lii dina faj te yow sa boppa amuloo lu la ci óor bu ko defee nga gën a lor nit ñi ndigte fagaru bi moom ñëpp a ko war a def waaye su la laalee tam war nga jéem a gaaw a dem ci docteur ñu faj la li ñoo ay symptomatique mooy wàññi say symptôme mel ni sa bakkan yi soote ko sa yaram bu tàngaak sa yaram buy
mandarga yi
yooyu mun nañ ko waaye pour génnee virus bi loolu amanguñ ko so bu kenn nekk di nax nit ñi because loolu óorut
waaw léegi ñu ngi dee wax ne am nañ virus bi dañ test positive ba pare ñu ñëw waxaati ne recover nañ comme amaguñ garab naka la ñu dee recover
waaw naka lañ recover moom xam nga yaram bi ci boppam daf dee xeex su virus duggee ci yaram bi daf ko dee xeex waaw su dee nag sa li ñoo immune système soldat yaram bi am na doole trop mun na ñëw contrôle virus bi ba du la lor di nga am feebar bi su yàggee nga gis mu denc ci sa yaram wala mu wàññeeku boo xam ne du la sonalati waaw loolu dafa des waaye nag am na ñoo xam ne ñu ngi am yeneen feebar yoo xam ne daf leen a gën a gàllankoor ñooñu seen yaram du am kattani xeex virus bi ni mu ko war a xeexee mooy ñi am diabetes ñi am high blood ñi am li ñoo ooyee ay cancer yi nga xam ne dafa wàññi sa immunity ak yeneen feebar yooyu dafa tax ba yow sa yaram du am doole xeex virus bi soo ñooñu gaaw na leen a sonal wala mu lor leen mu yóbbu leen àlaaxira waaye tamit virus bu mun a doon yaram bi daf ko dee fight su duggee see yaram bi am na ay soldaaram yoo xam ne ñoo ko xeex xeex bi nag ay façon la yenn ay cells la ci biir yaram bi yenn ay ci deret yi ci boppam ay yaram bi defar pour xeex virus yooyu yëpp am na so loolu nag kenn mënta xam nag kan mooy successful ak kana du successful loolu mooy problème.
ok ñu ngi jël opportunité bi tamit di masawo ñi nga xam ne ñoom ñoo jot a ñàkk seen bakken ci feebaru mbas bii nii waaye tamit ñi nga xam ne ñoom ñoo nekk fu nekk ni di jànkuwanteel ak feebaru mbas bii nii ñu leen di ñaanal yàlla fëgg seen bopp ñoom tamit ñu wér ak jàmm bokk si nag di vice président bi Her Excellency docteur Aïssatou Touré suñ ministre si nga xam ne ñoom tamit ñoo am feebaru mbas bii nii suma jëkkër ji Mamboudé Ndiaye ak ñeneen docteur Ami Fabouré minister of ma leen tudda sax actually waa ak yeneen ministre si nga xam ne ñoom ñoo jot a am feebar bii nii ñoo ngi leen di masalu di leen ñaanal yàlla may leen wér may leen tawfeex ba nga xam ne dinañ mun a delluwaat si seeni sago ba tey rek fu mu nekk ni ñu ngi ñoo wax ne waxtu bi jaamu nañu docteur rek da ngay wax rek ci kàddu yu néew balaa ñuy tëj waxtaan bi.
waaw feebaru mbas bi ñëw na te dafa mel ni xal nañu betta waaye tamit suñ health system bi dañ ko war a seetaat dik te doole ba mu waroon a am amu ko ba tey yàgg nañ cee wax nag waaye fi mu nekk dafa mel ni Covid bi mu ngi feeñal lu bari suñ intensive care facility mooy ñi nga xam ne feebar nañ trop jumtuwaay yi nga war a am pour toppatoo leen dafa mel ni manqué na trop am na yoo xam ne sax nekku fa ba tey di nga gis ne tam bu nit ñi baree trop docteur yi annonce yi duñ doy because docteur yi seen bopp annonce yi dañoo am infection ñi ñu yóbbu leen quarantine ñi ñu nekk in self isolation na yooyu di nga gis ne amuñ lu doy ci ay docteur ak nurses loolu luñ war a seetaat la jéem a yokka nombre bi
mbaɗigol ika foñala ko wato banta fereng pa Ousmane iɓe sarodi la ñaadila bi
comme c'est tento murundi mol mi yalan koy be lore ñil courant la kelo la loptan do kulal lembam fo jen lesol lembam police lu momo yalan koy be kata ko ke kan ka je ko ñin courant o badan na ñami be tentu la be jayla sa fo mo le ko hani kabi se bulol ku hani kabi ni ya ka fo kono ya kata kanata ka fo kono ba hanni bije ni mol sa sabañola anim fane bita dawoda ni la makso fana sita bo be mol be tentu lambe jahila
say ngamara min nyanta wala nga ñoo hakkili bulandi doro ka foko sartol mi yalon ko double heccio yalandi mole tamala bake albadi male mama jey programme o ñing mi ya natale num coming GRTS le QTV Paradise TV Star TV ay Africa TV ani Muslim Television Ahmadiyya milliard dépense wala jara kendi ala bundati man sakunda min londi jam wala Ministry of Health International Organization for Migration ani ila denyo ko tan albadi male mama jey mbaldi
Debunking COVID-19 myths. Myth 1.
Masila coronavirus kata boka mo fi wol mutalu.
Bari ko coronavirus de amasi fatam fans lo. Malum foi mo fi nedi, foi mo ko anda malum fana foi boda Afrika la ba, foi boda tuwadu. Comme ngombe nyaaja ba minke ga Afrika banko kanja. Andi yal nan dol fana la Gambia bo man tora kilima ko.
Myth 2.
Yalo ne numpura montere Gambia ja. Numpura mukabulu no dulamu yalo kandisal.
Numpura sa darano dula bele. Dula min kandito anin dula min suliya. Ko nyama na nyinde nya banko. Isa min ke no ko kam fo tanka nyin kura wala mun kambulo ko wato wati. Pour nyin kuran jankar ke so min bambulo baran sa fano nyame. Ntaka sombulo kandama numo anin nya.
Myth 3.
Foto nyalo mbang iko ni kanye lajo dom ake tanka ni corona jankarola
Hani de kisikisir ma woye tande ite kontine ke bulo ko jeni safunol ye metar kilim konto buleni mol tema anim fana jada kende abunda tan ko ya tande nyami isa wo noma pruke fongo tanka nyame ani kanuntel.
Myth 4.
Nin corona mo kombo courant dala santos nin corona man futa wata
hani de amanke ko mine nyi sa so kombon kol da male yaso modol be kono le mini ya lonko e bota nyi santol de
dama kontaan bu baax sax si ñëw bi nga ñëw seet si suma tabax gi kontaan naa ci trop trop.
maa gën a kontaan bi ma ñëwee fekk sa tabax bi toll fii waaye nag man kontaanuma ci sama kër gi man.
lu xew.
ndax umpale wu loon ne ñoo bokkoon nekk Europe.
dëgg la
jamono yu ñu nekkee foofu yëpp man ak yow maa ngi am benn waay maa ngi ko yónnee xaalis bu bari pour mu sampal ma suma kër. te ba léegi tabax bi àggul fenn. te yow nga waxoon ma ne ma bi nga starté samp yàggul léegi nga toll fii. foo jaar
li waral loolu nag mooy dama ànd ak waa Baluwo.
kon su ma la déggee Baluwo dañuy yëngu ci samp kër tamit.
ni ngay def nag yomb na da ngay log on to www.baluwo.com mun ngaa jënd ci ñoom ciment suuf banta weñ ba ci daaj yi nga xam ne di nga ko soxla lépp lu jëm ci wàllu samp rek mun nga koo am ci lu yomb ak Baluwo daal yaay dugal sa xaalis fi nga ko bëgg a amee ko ci ni nga ko bëggee.